Welcome back. This is Bottomline Africa. TB has recently slipped to second place in terms of being the world's deadliest infectious disease, but it still affects more than 10 million people per year and kills close to 1.5 million people, mostly in low and middle income countries. Now, latent TB infection, for its part, affects 1/4 of the world's population, and tackling it has been identified as one of the key ways to reach global TB elimination targets. Starting in February this year, a new fixed-dose combination treatment for latent TB is being rolled out in Ethiopia, Ghana, Kenya, Mozambique and Zimbabwe with support from Untitled and the Aram Institute. Joining us to talk more about this new initiative is Dr. Regina Ossi, who is a senior technical expert on TB and HIV at the Aram Institute based in South Africa. Thank you very much for joining us here on Bottomline Africa. Now, among the most vulnerable to coronavirus are those who have been affected with HIV and TB. How exactly did the coronavirus pandemic affect TB treatment?
Mainly, as you know, the coronavirus is also a lung disease, and people who already have pre-existing lung conditions will potentially not do well. We haven't yet seen any official study reports showing us exactly what the magnitude of the impact on having both TB and coronavirus would be. However, another aspect of it is that a lot of patients who get their TB treatment need to do so consistently for quite a few months. And depending on the type of TB, even up to a year. And many clinics and the health system was disrupted through the coronavirus crisis. And therefore, a lot of people with TB and HIV were not able to access their medications. There's actually a little bit of a silver lining, though, that maybe some of the intervention, what we call the non-pharmaceutical interventions that were put in place for coronavirus, such as social distancing, masking, and others, may have also improved transmission of TB, but we'll find that out only later in the year when we get more information about how these epidemics have converged.
There seems to be this term that has been talked about, latent TB. Most Kenyans or people are not aware of what it is. What exactly is the difference between latent TB and TB?
So basically, when you're exposed to TB, you can get infected by TB but not develop what we call active disease. It means your immune system and your body is able to actually keep the TB disease in check and manages to do so for quite a long time. What happens is that over time, the immune system may actually stop being able to keep it in check, or you may develop an immunocompromised state, such as HIV. You might get older and you have other conditions, and then all of a sudden your TB disease escapes your body's control, and you develop active TB. So in that latent phase, the phase where it is quote-unquote dormant, you can actually treat the TB and get rid of it so that you're not at risk of developing active TB. And this is why this treatment is so interesting, because it actually provides us an opportunity to shorten and to simplify the existing treatment that is available to treat latent TB. So with this new fixed-dose combination, you'd be able to take 3 tablets once a week for 12 weeks, and then you'd be able to treat your existing exposure of TB and hopefully will not develop TB going forward. Of course, if you're re-exposed, then of course it starts again, but that would be the gist, yeah.
All right, so then what exactly is the difference between the new therapy and what people have been using to prevent active TB?
So before, currently, and it's still a valid treatment, there's a treatment called Isoniazid Preventative Therapy, which is a pill that you'll take every day for 6 months. And of course, a lot of people dropped out at the end of the treatment because 6 months is a relatively long time to treat something that is not actively causing you problems. Most of the time when people are not actively sick, they tend to not take their medications. So this new fixed-dose combination is a combination of isoniazid, so the old drug, but we've added to it another drug called rifampicin. And because we've added that drug, we're able to take it only once a week. So you only actually take it once a week. And it's basically 12 doses. So you take it once a week for 12 weeks, and then you're done. And so that simplifies the treatment by quite a lot, shortens it, and also enables people to be more likely to finish the course of treatment.
All right, so the new treatment is targeting Ethiopia, Ghana, Kenya, Mozambique, and Zimbabwe. Those will be the first countries out of a total of 12. what exactly is the target population in terms of age, gender? Is it going to be administered to just anyone, or are there going to be specifications?
So generally, as I said before, latent TB it's very important to treat latent TB in people who have immunocompromised disease states. So mostly in our countries, it's going to be first and foremost people with HIV, and then also children under 5. So many countries have established guidelines around which populations should be able to take that. The WHO has also recommended that this treatment be given to people who are household contacts of people who have TB, because those are also at very high risk of being infected with TB and having latent TB and later developing active TB. So those would be your target populations. But then each country has then come up with guidelines around what would be relevant for their context, and also depending on the resources available, how many people they'll be able to treat with this new therapy.
All right, let's talk about the price of the treatment. It's around $150, if I'm not wrong. Now, most countries are reeling from the effects of COVID-19. Most people who are employed are now unemployed, and people are struggling to even survive even a single day. So then what happens to those who can't even afford $150?
So the price is actually great news, because it has been reduced to $15. So it's $15 currently for the 3-month course. And so that we feel is quite affordable. Most of the time in these settings, the drug is actually not paid for directly by the patient, but it's paid for through programs, for example, the Impact for TB program, but also PEPFAR and other international funders have this on their list, especially for highly vulnerable populations like people living with HIV. So it's definitely not necessarily going to be directly incumbent to the patient to pay for the $15. But the price is also a great breakthrough, because $15 we deem is affordable and also effective.
All right, TB has recently slipped to second place in terms of being the world's deadliest infectious disease. Going forward, you know, keeping in mind that there are issues such as the coronavirus pandemic, how exactly can we prevent the spread of TB going forward?
So I think TB is a very old disease. We've had it for a very, very long time. Unfortunately, the investments globally into finding a permanent cure and being able to eradicate it have really not followed on. And so, you know, hundreds of years later, we're still saddled with a disease that kills quite a high number of people. And only this year has it been surpassed by the coronavirus. And so we really hope that with the findings and the accelerated focus on global health that the coronavirus has brought about, that there will be further resources to enable us to really find a cure, find a vaccine, and really actually enable us to get rid of TB once and for all. In the meantime, of course, you know, things like social distancing, wearing masks in the public settings, making sure that you get treatment if you've been exposed, and also looking at making sure that we address our crowded settings and areas where people congregate would also be greatly beneficial to the TB epidemic.
All right, that's a good place to end it. Thank you very much, Dr. Regina Ossie, a senior technical expert on TB and HIV at the Oram Institute based in South Africa. Moving on, tired of waiting for someone else to solve the problem, Zambi Mate founded a factory to turn